Hi everyone, I'm Erin Rosales, and just like to give an answer to a question that I get on occasion, and that question is, how do I become a medical interpreter? I wrote an email response to somebody not too long ago, and I just kept on typing and typing and typing, so hopefully I'll be a little bit more concise for this particular video. So first off, how a person becomes a medical interpreter can vary from place to place, and that's a different question than how somebody should become a medical interpreter. So it is entirely possible for somebody to become employed or to get a gig as an interpreter, as a contract interpreter, because they say they speak 2 languages and they were willing to show up for an assignment. That should not be the bar or the standard that we're reaching for. Kind of reminds me back when nursing started as a profession or as a career, right? Way back in the day, think Florence Nightingale. The qualifications that you needed to become a nurse were to be able to sew well and not faint at the sight of blood. Think about that for a minute, okay? The standard for interpreting and being a medical interpreter kind of ages ago was about the same, right? As long as you speak 2 languages and are willing to be in a medical environment, off you go, you're ready, right? Not at all the standard that we should be pursuing or shooting for as individual professionals or as a professional community as a whole. So how does one become a medical interpreter? Well, first off, you should make sure that it's a right fit for you. So yes, you need to have the language skills. You need to have the cultural familiarity to be successful with managing the demand that you're going to have on your linguistic abilities, but you also have to make sure that healthcare is the right fit for you. So do some reflection about that. Do I enjoy using my language skills? Do I have the level of proficiency necessary? And am I willing and eager to learn the skills to then be able to interpret? And am I going to enjoy the healthcare environment, all the dynamics and challenges that brings along with it? So after you've done some reflection on that, then you should start thinking about finding an initial training program to complete. Now, so for some people, this is maybe an online training program. For some people, other people, maybe it's going to be completing a program at a community college, or other people, other academic institutions, or even through an employer. But before you dive into that first assignment, before you accept that first gig, if you will, make sure that you have gotten appropriate entry-level training so that you know what's expected of you and how to perform when you are on your very first assignment. It doesn't stop with the initial training though, or that classroom training experience. If possible, also think about how can I immerse myself in the healthcare environment? What videos can I watch? Can I do a job shadow? Can I go to a hospital or clinic and start making some different connections to feel out what it will be like for me working as a medical interpreter? The more you're able to immerse in the environment where you will actually be interpreting, the better prepared you will be when it's actually your turn to be on stage or on the spotlight, so to speak. So initial training and complete that. Also think about pursuing the certification. When you're going through your professional journey and your professional performance, you'll want to make sure that you're reaching for the highest credential standard possible. And currently in the United States, there is national certification available that you can certainly pursue regardless of the languages that you happen to be speaking. So think about that as another step in your journey. So what can you do to become a medical interpreter? Make sure it's the right fit for you. Make sure you get an appropriate amount of training to be a safe and effective professional to begin, and continue your professional journey through continuing education and pursuing that certification as well. That's what I have for you. Happy pursuing your interpreting dreams. Talk to you later.